South Carolina Medical Association.
Good morning, and thank you. I appreciate that, and thank y'all for having us today to talk about this issue. I'm Rochelle Taylor. I'm General Counsel for the South Carolina Medical Association, and we are in support of the bill as well, and just wanted to provide some insight as to why physicians are here in support. Our physicians have stayed open during the pandemic and treated the patients that came to see them. It was not an option for them to close. As you know, no matter if you had COVID or something else, physicians are needed. And this was one of their times to serve and to shine. But many of them are concerned because they were doing novel treatments in the beginning, not knowing what the disease was, and trying to help their clients as best they could. They had to delay surgeries of some patients or delay care while they saw COVID patients, when you talk about physicians in the hospitals. And then in our local practices, they were trying to treat COVID patients that weren't going to the hospitals and to keep them out of the hospitals and trying different measures. So from that standard, we see this liability protection as important because it protects lawsuits that may come from delay of care or novel treatments, and that's very important from the physician side. Physicians are unique because they are both employees and business owners, and they still support this legislation from both sides of that because they see protection in allowing them to serve despite lack of PPE and trying to keep their staff safe and all the challenges that they went through. It would provide them a lot of peace through these efforts, and I think that they have been real troopers in staying open, and I think that it's important that they have this protection because we know that a lot of time lawsuits aren't filed immediately. It takes a year sometimes to gather a medical case, and we still think that we'll be seeing cases down the road from this. And so that's all I've got. If y'all would like to ask any questions, I'm happy to answer them.
Any questions for Rochelle? Senator from Williamsburg.
Thank you, Mr. Chairman. Thank you, Ms. Taylor, for being here. You said something that sort of sparked an interest in me, where you all are in the unique position of, in essence, having employees and business owners, and that's the position that the doctors find themselves in. Would you help me with an analysis as to whether or not this kind of legislation has any place in the workers' compensation world?
So I think the workers' compensation issue is very separate. My understanding is that the claims that have been filed have been handled at the workers' comp. They've been taking claims on that, and that there have been successful cases on that side.
And you would agree with me that that's the way that it ought to be, and that workers who contract COVID as physicians, our frontline folks, I mean, you know, they literally put themselves at risk, and some of them, unfortunately, come down with the disease. You would agree with me that benefits ought to be extended to those individuals, and we ought to make certain that this legislation does not impact those kind of claims.
Yes, sir. I think when there's a mechanism in place, that's what should be used. I think what we're trying to prevent are large lawsuits with additional liability, but certainly there needs to be a mechanism for employees to go and handle those type of issues.
Yeah, absolutely. And you may have heard the discussion earlier as it relates to unintended consequences and how sometimes good and intended legislation eases its way into an arena like workers' comp that would, in effect, in my mind, hamper rights that ought simply be afforded to individuals who are injured. And so I will thank you for that exchange.
Any other questions from members of the committee? Okay, thank you, Ms. Taylor. So we're running a little short on time, but I think, is there anyone that we